Dr. Vinito Chishi's dedicated work within the Nagaland Legislative Assembly through the Legislators Forum on AIDS towards HIV/AIDS prevention holds important significance. Honored by the Nagaland Legislative Assembly for his contributions and a recipient of the prestigious Governor's Award. Dr. Chishi's commitment was vital to the state's multifaceted response to the HIV/AIDS epidemic. We reflect on his journey, his collaborative efforts within the Assembly, and his advocacy for continued action at the grassroots level, even as the landscape of HIV/AIDS prevention evolves.
I'm a family man having wife. My wife's name is Vinito, and we have 5 children, 4 sons and 1 daughter. Yes, they are all working now. They have finished their studies and they are working in different places.
Greetings viewers and welcome to Doordarshan Kendra Kohima. Today we have the distinct honor of speaking with Dr. Vinito Chishi, a recipient of the Governor's Award and former Joint Director of the Directorate of Health and Family Welfare Government of Nagaland, who dedicated years to public service and played a pivotal role in Nagaland's fight against HIV/AIDS. Following his retirement in 2007, Dr. Chishi embarked on a crucial second chapter, serving as the state coordinator of the Legislators Forum on AIDS from 2008 to 2018. The vital platform brought together Nagaland's 60 MLAs of the Legislative Assembly to address the critical health challenge. Join us as we delve into Dr. Chishi's experiences and the impact the work of the Legislators Forum on HIV/AIDS in Nagaland.
I'm a doctor and I work in medical department in Nagaland. Most of the time I was in Kohima in the Directorate of Health and Family Welfare. Towards the end of my service, I went to Sang as medical superintendent and then came back again to work in Nagaland State AIDS Control Society, which was attached to Department of Health and Family Welfare. And I retired in 2007 as additional director in Nagaland State AIDS Control Society, but I was reverted to main department, which is Department of Health and Family Welfare. And there I resigned, I retired as joint director.
To begin, Dr. Chishi, would you paint a picture for us on the environment surrounding the Nagaland Legislators Forum on HIV/AIDS? What were the pressing concerns that led to its inception?
Since I retired from Directorate of Health and Family Welfare and Nagaland State AIDS Control Society in 2007, I had a call from UNAIDS, it's a United Nations on AIDS, India, in New Delhi, and they asked me whether I would like to join UNAIDS. That is to do with Legislators Forum on AIDS, because they had then formed a parliamentary forum in New Delhi among the parliamentarians, MPs. So about 480 MPs there, and they have already, during Congress time that is, and they have already formed parliamentary forum in New Delhi. And that is to go through all the MPs to be responsible for HIV/AIDS, because HIV/AIDS was very critical at that time. And so they thought of it and they said, well, parliamentary forum, but all the MPs are coming to Delhi only for sessions, and when they go back, they are not known in the states. And therefore they wanted to form Legislators Forum on AIDS, So LFA we call it. So Legislator Forum on AIDS. Why? Because in the states, the legislators, the MLS are very important along with the chief minister. And so all the, not only Nagaland, but all India, they should form legislators forum. And of course, Nagaland State AIDS Control Society was there, but like other, like Nagaland, all other states also, about, at that time about 23 states were there in India. Now it's coming to 28 states. And so now that time they have formed Nagaland State, State AIDS Control Society in all states of India. But this parliamentary forum in New Delhi, which they formed during Congress regime, could not cover all over India. And they found that MPs cannot do anything unless we penetrate the states and work through MLS. So likewise, all states had intention to form LFA in all other states, but starting particularly from Northeast India, because Manipur and Nagaland were very popular at that time, popular in the sense high percentage of HIV/AIDS, and then another one was Mizoram. So Manipur, Nagaland, Mizoram, and then Meghalaya also, but mainly Manipur, Nagaland. These are the two states they focused, and so it was formed in 2008. 2008 LFA, Legislators Forum on AIDS, had been formed, and then I was appointed as state coordinator for LFA, Legislators Forum on AIDS, to work among the MLS, 60 MLS, with the chief minister. And so that's how we started LFA in Nagaland. And it continued. It was formed in the year 2008, as I said, and that was the 11th Nagaland Legislative Assembly. 11th. So 2008, and then 2013, after 5 years again, it continued, and then 2013 to 2018 it continued. And I retired in June 2019. It was effective, very effective. In fact, in the whole of India, I should not praise myself, it's not my praises, but I should praise Nagaland Legislators Forum, because they give 100% support in this Legislators Forum, because HIV/AIDS was very, very high percentage in Nagaland. Prevalence rate was very high. And so they all supported, they all participated, not only financial support. Financial support was, this MLS had local development area fund. And earlier they were contributing 50-50, but by the time I came, it was 75,000 rupees for each MLA for this development fund. And later on, very soon it was raised to 1 lakh, and so, of course they have more than that, but they supported with 1 lakh of rupees each MLA. That means 60 MLAs, 60 lakhs of rupees. They contributed each one, and to LFA fund, that is Legislators Forum on AIDS fund. And with that, we ran the program, So it was effectively running, and every time we have a meeting or, campaign, HIV talks or campaign in each constituency, we can say, each constituency, I used to say, call in Southern Angami MLA, 2 of them are there. So if I go to Jakama, Konoma, Kuzama, And if I go to Western Angami, then I call the Western Angami MLA to come and give a talk, along with me, and I mobilize the public, and they come and give a talk on the HIV. So not much on the political talk, but HIV. That HIV should be stopped, and it should not go high. It must be reduced among the people. So this is how we used to involve MLS in all over 60 constituencies, and they participated very well. In fact, UNH said that Nagaland is the champion of HIV/AIDS, control. And so, in fact, from 2.5% prevalence rate, it came down by the time I went out, it came to 0.88%. So it came down very, very fast. Over the years of 10 to 12 years, it came to 0.88%. And so it was very successful, but now it's again more than 1. It was successful, and in UNH office in Delhi, they said Nagaland is the champion of HIV/AIDS, reduction of prevalence rate. Manipur was high as well, but Manipur, they could not continue for more than 6 years. But Nagaland continued, even when UNH stopped supporting this HIV/AIDS program. Nagaland still continued for another 5 years without the UNH. See, without UNH support from the center, they continued. It's okay, we'll continue for another 5 years. So it went on another full assembly, and it continued till 2018. And 2018, they said, okay, we have done enough, and in fact, it has come down below, prevalence rate has come down below 0.88, and therefore, let us give a stop there, put a stop there. And they wanted to divert the HIV fund to Legislators Forum's fund, and also partly divided into 2 parts, and they want to support the women and also legislators who get sick, and we need to support them by paying them, medical treatment support and all that. So they divided, and that's up to them, whichever way they want to put it, but they said they are going to stop supporting HIV/AIDS program. And so that's where LFA ended, Legislators Forum on AIDS ended in 2018 by June.
Dr. Chishi, in your time with the forum, what were the fundamental challenges that you have faced in tackling the HIV/AIDS epidemic in Nagaland?
Yeah, challenges are definitely there, because HIV/AIDS being not like any other disease. In fact, we don't want to call it disease. It's just a normal way of life, because it is not like cancer, nor is it like malaria, or is it like diarrhea, which comes and goes. But HIV goes along with society. It's a development disease. Now in the postmodern society, the society is so free that as development goes on, more people coming from outside, and even we ourselves are not able to cope up. In the process of coping up with the society and the progress of the society and the development, various kind of development, many people come and go, and there are a lot of intermixing of people and different type of people, different, not only within India but other countries, people come in, we have, encouragement and motivation for tourism and all that. Tourists come in, and when tourists come in, we have to take them all over, and that kind of things. And people come with money, and we Nagas are normally not very rich, poor, and we like to be excited with people, mixing with people. Nagas are very free people, and so we want to mix with people, and so all these things are in our society. They come in together, with our society, with our friendship, with our communication in every way. And so HIV also comes along with that. That's why the challenge is, because we cannot recognize, it is not airborne disease, or it is not food from food, or a poison, but it just comes naturally, and we don't know who is having HIV and who is not having HIV. Nowadays, of course, we have medical science has developed so much, and we can get ourselves tested, our blood testing can be done, and we can be relieved of our HIV. We can remove that ignorance of staying away quietly, and we can get our blood tested. And once we find ourselves positive, then we can take care of ourselves. There are medicines, many medicines which have come, so that it can prolong, your life without getting sick. And also there are medicines which can improve your immunity, and so that can strengthen you to defend other infections, and you can stay longer even as a HIV positive. There are so many, more than now 20 years over. I see them when I was working in NSACs, and found them as positive. They are still alive. I'm surprised. Actually, I could believe it now. When I see them, they are still happily walking around, and they wish me as well. And it's more than 20 years. I retired 18 years ago now. And when I was there in service, looking after them, they were HIV positive, 4 or 5 years positive, and still they are walking, and they are working also. So we can live longer. In fact, I used to say those days, HIV/AIDS is actually a very lucky disease, we can say. It's not like cancer, who can survive about maximum 5 to 6 years after detecting as cancer. We don't, God can heal, and that is there, but very rare. But all cancer patients, after detecting as cancer, they live not more than 5 to 6 years, and they die. Except when God intervenes, they get healed. And so such people are also there, but majority from medical science, medical point of view. So HIV is in one way, if one can take care of oneself, and it is also morally implicated. And so if I know that I have done something wrong, or sexual relationship with somebody, unknown person, and I have contracted HIV, then I should be conscious of that fact and get my blood tested to see whether I'm positive or not, after maybe within 1 to 6 months. After 6 months, invariably after sexual contact with people, if you have gone 6 months with a HIV positive person, after 6 months you will definitely be HIV positive if he or she is having HIV positive. If after 6 months you are not having HIV, then you are safe, even though mistake, we have committed mistake.
Contribution to fight against HIV/AIDS in Nagaland.
My contribution here, I think we did a lot of, not I, but as I said, we, legislators from, or even for that matter, Nagaland State AIDS Control Society, we are having a separate society and we are fighting exclusively for, working for HIV/AIDS to control, to bring it down, to eliminate it. We can never eliminate. As I said, it's a moral condition that is involved, but we cannot eradicate, but we can reduce the prevalence rate. And so that we have done a lot of education programs, and so we say awareness program. Properly, awareness is not, hey, that HIV is there, is not the thing, but how HIV is spreading, that clear education, awareness and education should be given to the community, to the people, common people, everyone in the institution from university down to primary school level and to the village level, to the churches. All these platforms we have used and we have given proper education, not only creating awareness, but to be more responsible by creating awareness that each one will take, responsible condition. And that also will lead to the community down at the grassroots level, remote grassroots level, because HIV can go to any person anywhere. It's more poor and more rich, but it can go into general population. And so the entire population of Nagaland should know that HIV is not good, it is dangerous, and it is treatable, but not, we cannot be healed by that. We cannot prevent. And so, in a way, it's a preventable disease, we can say. HIV is preventable. But mostly because it's not because of medication, but because we can take care of ourselves. And so it's better we don't get involved. And so HIV should not spread to any individual, and we should be morally upright so that we cannot make a mistake by carelessness. And so awareness is to be created to everyone, from high to low individuals, in persons everywhere in Nagaland and all over. And also in the institution, colleges, and the universities, we have to tell that, because
Recalling your journey in the early days, what were the driving forces or personal motivations that urged you to enter the medical profession?
That's those days, in our days, early days, there was no doctor, and most of the time, three professions. What do you want to become? You want to become, actually, I wanted to, initially, when I was in the primary school, primary level and high school level, when they asked, what is your hobby and what is your aim and all? I said, I want to be an IAS officer. That was one. There was very few IAS officers I can count. So that's why I wanted to become number one. Number two is everybody wanted to go, in our days, in our batches, want to go for engineering and medical. And jobs are available. Even when I finished my medical studies, people come and say, join. I said, I'll join, but let me relax for some time. We are not aware of seniority and junior kind of things in the long run. So I said, jobs were available. And my medical senior officers, they say, hey, Dr. Vinito, why don't you join? Come tomorrow to Naga Hospital and join. I said, let me relax for some time. I used to say that. Jobs were available, and people in the offices used to search for candidates to go for medical studies and all that. Number two, engineer, medical, and third was veterinary, and the fourth was to become a lawyer. These are the four areas students were interested. That's why in our batches, those people who have got other things, but who were a little better in studies, they all went for engineering college and medical colleges. And so quite a lot of medical people came out from our batches. But it came down again, and now it's coming up again.
What are some of the ways you continue to stay busy and engaged in this new chapter of your life?
Yeah, it's all over now. My service is all over now. I'm involved in mainly in the church activities, and so I'm now, as I said, I'm involved in what's called association, in the tribal association. We are running medical college. Theological college, and I'm a chairman in the theological college, and thereafter tomorrow we are going to celebrate what's called graduation day. That is coming at the end of the year, so graduation day, I'm going to attend that. I'm involved in that to improve our theological studies and institutions, and also to get recognition from other universities. And so I keep involving in those areas to help them out. And of course, here at local church, I'm a deacon in city church, so involving nothing much to do, but then involved in the church matters, and also in other society. I'm also involved in Nagaland, so it's a little, little political tinge there, but the Nagaland, we do have meeting. What shall we do? How do we keep up with the Nagaland? How to address important issues about Naga matters, Naga affairs. And also I'm involved in, I'm a member, advisory member in Senior Citizens of Nagaland. So we have that association. So I get involved in those areas to address, common issues, including political issues, but mostly social issues, community issues, and political issues also important because we are all, fighting for independence or something like that. And so, what is best for us?
Drawing from your own experiences, Dr. Chishi, would you like to offer any advice to those who have retired or are approaching retirement?
You see, the message to my colleagues is that, of course, I'm no one to advise anybody or suggest anything, but we have a lot of people, retired people, colleagues, and very close friends also. So unfortunately, some of them have died who were active and also moving together with us, but they have gone away. Life belongs to God, and so they have gone away. They took ill, and through illnesses they have already passed away. But those of us who are alive, we encourage one another and involve for solving certain important issues that we commonly face. Not my individual problem. Individual problem I'll have to solve it by myself, but to get involved people and have a common idea and give our opinion, collective opinion as to how we can improve our society, our communities, and how to voice out to tread on the right path. Today we have so many things involved around us, and everybody is looking for their individual benefits, the vested interest, but not common interest. So individual interests are there everywhere, but the common interest for the people, not our family or our tribals, our tribes, but our community in general. What is good for all of us in Nagaland? For that matter, even though we are not actively involved in that like government and our IAM or NNPG or whatever for Naga independence, but what three of us also are Nagas, and what is good for me, and not what is good for them, Mr. A and Mr. B, but what is good for all of us is the one I want to walk on that path, to suggest whether people are doing right or wrong. We don't have to quarrel, but to tell them, to suggest that to go by the right path is important. Leave aside our personal interest, but have a common interest so that we can achieve something. And that is the only thing that we want to pass on the message anyway, as long as we are alive.